forward to learning from you. And at this juncture, I'm calling upon Rotarian Stella to introduce our guest speaker. Over to you, Rotarian Stella.
Thank you, we have he is an alumni of King's College, Budo, Makerere University, and the University of California at Berkeley. He is public health specialist with a major in maternal and child health. He is also a governance and capacity building consultant. He also trained as sports medicine, has worked in MDA and last served as chief medical officer of KCC. Thereafter, been a consultant for national and international with local NGOs and local groups. Was sports doctor for Uganda Cranes for many years. Medical in 1978 African Cup finals. He's a charter member of Kampala North and a charter president of RC Mutungi. Mr. Mtesasia is married and is married with children and grandchildren. His hobbies are cooking, football, singing, music, and garden flower. So join me to welcome Dr. Timothy Mtesasia.
Very much, Stella, for that kind introduction. And I thought by now my presentation will be on the screen. Because what's wrong with the putting this one there and you connect the HDMI? This, because I gave you a HDMI cable.
Yes, but it is to connect on the internet.
Huh?
It is not connecting to the internet.
You screen on you focus on the screen. It's on one of the areas of where they operate. This year, every year in April, we focus on mother and child health, or maternal and child health. Vicky, when you say maternal, what do we understand by maternal? I didn't say parental, I said. Okay, we are focusing on the mothers, you are correct. And when we talk about children, we are focusing on anybody between 0 and 15 years. But now we have come to include the adolescents, those who are up to 25 years. So when we talk about mother and child health, we are talking about medical and social services which are provided to mothers and children. And when we say mothers, we are specifically targeting the age bracket of 15 to 49. Because that is the productive age. And when we talk about children, we are talking about but because of adolescents, we now include those up to 25 years old. Now, medical services include antenatal, natal, and postnatal. It also includes family planning. People should get pregnant by choice, not by accident. So when we talk about MCH, we are targeting the mothers before they get pregnant to prepare them for pregnancy mindset, and also to prepare them when they are pregnant to ensure that the mother and the baby survive. Not only focusing on the child. Some countries they focus only on the child and they say, Mama yalira bana naye omwana kasita bamuzala, you know, that sort of attitude. And we also want to look at the mother after they have delivered. This is postpartum. So that we have a healthy mother and a healthy child. The mother delivers and she's healthy to be able to. Adolescents, we are talking about adolescent sexual and reproductive health. How do these children, you heard of the Sengas and the Kojas in the past, but in modern medicine now, we must prepare these children to enjoy adolescent sexual reproductive health life, so that they know what they are going into. Most of these girls get into these things and they start crying. You know, hey, what do you expect? We must teach them that when you go swimming, you must be prepared to get wet. Because you don't say, I'm going to swim, but I don't want to get wet. That doesn't work. And you see, even in Rotary here, when we are talking about medical services, we forget the social services. I told you MCH includes medical and the social services. What social services are we talking about? We are talking about substance abuse. You see young men, even at campus, getting soaked in alcohol at very odd hours. And when they drink in excess. That is substance abuse. You go around the corner to that canteen those days. I don't know if the canteen is still there, young men. Is it still there? It's now near what? Near college school, that building. Now you see those people, they are rolling those papers in, they put in substances. They drink and they get a bit knocked out. That is substance abuse. When we focus on MCA, we should be able to focus on recreation as well. When you go to basic education and literacy, you don't only give the books, give the boys and girls, give them some balls for basketball, for netball, for football. Give them nets for badminton. These things are not very expensive. And also, the difference between MCH and other disciplines of medicine is that in mother and child health, we are focusing more on promoting. What am I saying? We are promoting health and we are trying to prevent hazards in health. So if you go for family planning, you are trying to prevent dangers, teenage pregnancy, abortions. You go and look at the mothers. When you prevent dangers to the child, to the mother, which will occur. Why should we focus on?
Why should we focus on mother?
Mothers are the basic educators for the nation. You educate a mother, you educate a family. who are not sensitized, they will give the money, sit first, and will take it. Right or wrong? So the gender, they are targeted, they are marginalized because of their gender. So we target them in health, and we want to prevent the dangers because these ladies are very prone also to HIV, unwanted pregnancies, and other sexually transmitted diseases. So if we target them, we are saving them from the risks because they have got the physiological burden of carrying these children, the physiological burden of pregnancy. So by focusing on them, we are really doing a service to the mothers. Now we are focusing also on MCH. Why? Because MCH, being preventive and promotive, it is cheap. It is much cheaper to conduct antenatals than conduct cesarean sections. Because during antenatal, you will have screening. Getting these complications of pregnancy, bleeding, and death, they are very cheap. You use a midwife to run an antenatal clinic, and she will only refer where she thinks her expertise cannot manage. And when we go to immunization, it is very cheap to immunize a child, very cheap. We are using midwife and nurses. Whereas if you go to other complicated cases for treatment, we are using specialists, and this is very expensive to pay. And when you are sponsoring, for example, an antenatal or an immunization campaign, you have done it in Katanga, we've done it in Katanga. Is it very expensive? No. But you say you are going to sponsor mothers who cannot deliver, they have not been spotted, and they get complications of pregnancy, like an oblique eye. These are things which we need to look out in MCH, prevent dangers, and provide the adequate treatment. Now, when we talk about infants, there is a measure of what we call infant mortality. Infant mortality is the number of deaths of children who die before they reach their first anniversary, their first birthday, out of every 1,000 live births. This is an indicator of the quality of healthcare in a country. It is unfortunate that you can't see these things. That's why I wanted a projector. It is better to see these things there, and it will make my presentation easier. Because when I talk here, you won't be able to appreciate like they would have been projected there. I don't know what the problem is. Why don't you put your camera on this table? Sorry, friends online. I want our IT gentleman to get these, capture these things so that we can be on the same page in my presentation. If you look at those tables, the figures in that table shows you the level of healthcare we have. For example, if you look at Uganda, we are at 33.4. For every 1,000 live births, 33 children die before their first birthday. And if you look at a country like Japan, only 2.8 per 1,000 live births. And under our neighbors here, they have moved. Rwanda is now at 26.3 when we are at 33. That is an indication that their level of healthcare, has, I don't want to use the word, but that's what it is. And then you go to a country like Angola. Angola is at 50. And a country like Sierra Leone is at 80. 80. For every 1,000 children born, 8 died for their first birth. So if you are going to visit, please ask for the infant mortality and the maternal mortality. It will tell you how prepared you should be with your health insurance. Okay. Now, another measure of the quality of health care is maternal mortality. Next table. Next slide. If you look at the maternal mortality, these are the number of mothers who die due to causes of pregnancy or childbirth. Number of mothers per 100 live births. For every 100,000 children, how many women die? These are measured, for example, you take Finland is 3, Sierra Leone is 1,300, DR Congo is 400, Tunisia is 62, Egypt is 33, and Rwanda is 320. Uganda 336. We used to beat Rwanda by far bigger margin, but they are focusing their resources where they think the problem is. As I told you, MCH is preventive and prevention is better than, and now we add, it is not only better, but it is cheaper. Prevention is better and cheaper than cure. Next one. What are the objectives of, I'm sure, President, you asked me about the role of a Rotarian, but you cannot go into a role when we don't understand the subject matter. That's why I have started from this background, and we shall go to the role of a Rotarian. Now, in the MCH, we want to reduce the morbidity. Morbidity is the burden of disease. We want to reduce disease and death. So if we go for antenatal, we want to reduce the problems caused by pregnancy, anemia, pressure, bleeding, recurrent malaria, poor birth weight. These are the problems which cause problems in pregnancy. So we reduce that disease. So what do we do there? In antenatal? What do we do normally in antenatal? Young man, you are going there, or you are already there. No? In an antenatal clinic, we check the weight of the mother. Is the mother gaining weight, which means is the baby gaining weight? Is the fetus growing? Because as I will mention later, MCH, when we go there, we want to reduce the percentage of low birth weight babies. A baby should be born heavier than 2.5 kilograms. So to avoid this problem, because that is called a premature baby, to avoid that one, we do our antenatal. And in our antenatal, we do a weight check. We check the height, because the height of the problems in childbirth is related to the height. We get the level of hemoglobin. We know whether the mother has got pressure. And we also check on the sugar. These are simple things. If you check on those and they are okay, then you are sure the mother is going to come out properly. And to check on the deaths, what causes deaths in mothers? Normally, it is this proportion which was not checked. The mother did not attend the antenatal, and they are for less than 5 feet. So they go into labor and they find they cannot deliver by these traditional birth attendants, and they are rushed and they are late. They arrive when the child has got distressed and they die. 2, anemia. The child, it is natural that when a woman goes to deliver, they bleed. But if you bleed when you don't have enough blood, what happens? You die. To detect the danger, there are people who are seen to be of normal height, but when you take the measurements at antenatal, you find they cannot deliver the size of the baby. That's why this clinic should have a weighing machine. Some people gain more weight than they should, given their basic metabolic BMI. Young man, do you know what BMI is? Who knows what BMI is? Please help us. I'm sure I know.
Let me try. Yeah, BMI is established through measuring my height against my weight, so as to establish whether that's normal or not. Obesity versus the normal.
Metabolic index. Now, your body is supposed to carry a certain load. Your organs, depending on the size, are supposed to carry a certain load and service that load. But when you become overweight, the body is burdened, right? So you measure your weight in kilograms. You write 70 kilograms, for example. And you divide it by your weight in meters squared. So if your weight is 70 kilograms and your height is your 1.5, 1.6. Okay, let's say 1.6. So you square 1.6 times 1.6. That comes what? So you get 70 divided by 1.6 squared. Tell us what it is. Then I'll tell you how you know the data problem. Yes? Comes what? Should be 20 something. 27.3. Then that one is in a very good state of health. It should be between 25 and 29. If you are below 25, you are underweight. If you are over 29, then you know there is a problem. If you cannot control your height, you control your weight. Don't make sure don't get into 30, please. 30 is the best idea. So go home, measure your weight, get your height, and do the calculation. It is weight in kilograms over height in meters squared. You should be between 25 and 29. 29 is turning towards obesity, but as far as you're concerned, it's a bit safe. Okay? So, pregnancy health and behavior. The mother, you know, pregnancy also changes the behavior of the mother. So we must look at the behavior of the mother. There are mothers who go into depression in pregnancy. There are those who become hyper during pregnancy. So all these must be controlled in our MCH. And then that is preconception health also and behavior. We must also look at the health of the mother after birth and behavior of the mother after birth. Some of these psychiatric disorders after birth can be detected during these antenatal or natal examinations. And then we come to disability and other impairments. That one comes in the area of the children. Children, normally we don't look at only, say, in basic education and literacy. We are focusing on those who are in school and those who are normal. But we tend to leave out those who have got disabilities. When I come to community needs assessment, during MCH, we should go and look out for these children with disability, children who have got, who are positive for sickle cell, children who are positive for HIV, and children who are diabetic. They are there. And those who have got physical disabilities, MCH encompasses them all, right? And then we have to look at infant care. Who is an infant? I told you an infant is a child who has not got to his first birthday. So infant care. Are the children being breastfed? Have we taught the mothers how to breastfeed? Have these children been immunized? How many of you have looked at a child growth card, young child clinic card? Does anybody know how to interpret it? Because some of you are getting grandchildren. When you visit these grandchildren, when they come, I ask my daughter-in-law, and I look at the card and I say, yes, I want to look at it. There are those two curves on the card. The upper one is called the 90th percentile, and the lower one is called the 60th percentile. A child of a well-oriented parent should be between those two, and it should be nearer the upper one than the lower one. If all is well, it could even be above the upper one. That means your child is gaining or has got 90% of the expected growth weight. If it is nearer, surely Muzukulu wa Mchalantale cannot be nearer the 60th percentile. It means he's almost falling into danger. But you know, these young girls which our sons want to marry, they have never been taught how to cook, how to look after children. So, Mchalantale, these are the things, Helen, these are the things you take up. It's not Lugezi. Now, then we look at other health issues after we have done those basics. Okay? Now, when we have gone into the actual practice, what we want to do is we want to reduce. How many of you have gone for burials of mothers who have died during childbirth in the recent past? When did you last go, Helen? Helen? I don't recall. In the last 5 years, I haven't gone there. Rotary and Stella? Come again? And the baby died. Yeah. The MCH intends to reduce the deaths of fetus, that is children who die in the uterus, and those who die at birth. These days, I think we thank the government a bit. We thank the government. These days, even on CBS, you take time to hear Yafiri Demurutaro, isn't it? There was a time when it was so common. That means she did not get help. She did not deliver in health facilities and did not get enough assistance to survive. So that one, we will have to do it in MCH. We also reduce the rate of deaths of the children around below 28 days. We call that one perinatal death. The child who dies within 28 days of birth, that is perinatal death. And also, we want to reduce the rate of death of children under, that I said 28 days. And then we reduce the children of what they call sudden infant deaths, SDS. That is children who have been well. They used to call them cot deaths. The child has been healthy, is fed, put in a cot, and the mother goes away. And by the time they come, they say, I found the child dead. And we know the causes. If the mother attends antenatal and postnatal, they are trained on how to look after their babies when they are young. They put them in a cot in a particular position. When you feed them, you have to remove the air. Isn't it? And there's a position they shouldn't lie immediately after feeding and bathing. These are all trained to the mothers. This is MCH. So when we talk about MCH, it means it encompasses more than medicine. So, Madam President, you allow me to go to the role of Rotarians because I've got about 15 minutes left. What are the role of Rotarians? This subject you can visit and visit and visit. What is the role of Rotarians in promoting MCH? Number one, be a role model. Be a role model. If you are in this young men's age, behave like a Rotarian. Leave young girls alone. And if you want them, Tell them that we are going swimming, but the consequences are likely to be there. So let's take care of the consequences, not just abandoning them because for you have finished your what? Yes. If it is people who are married and they are still productive, space your children. You don't produce like rabbits. Advise your partners to go for antenatal and accompany them. Provide food to your family so that the issue of nutrition does not become an issue in a Rotarian's home. Do you know that there is the adult malnutrition? You look at a poor woman, she's pushing the pregnancy, the cheeks are almost falling down. If you touch the skin, it can be elastic. And you know, this is adult malnutrition. They're not feeding well. You look at the eyes, they're anemic, and these are Rotarians. Can it happen? No, it shouldn't. Let's know. Number 2, do advocacy whenever an opportunity arises. Advocacy. Advocacy means what? Do you have a lawyer here? Aha! Speak for others. Advocate for what you believe in. Be like the politicians. Politicians, whether it is burial, what, so as Rotarians, when we go to this function, can we speak? How many children do we see when we go to Kwanjuras and the Uzika? And you see a child. Do you ask, has this child been immunized? Where do you stay safe? Mutundo, where? Mutungo. How many vaccination centers do you know and antenatal places near your place? Yes. Go and find out where the family planning clinics are, so that when you see your age mates misbehaving, you tell them, can you go to this place in Kiswa? Onabu. I think you need this service. You say pregnant woman, tell them in church, at burials, tell them. And when you tell them that go for antenatal care, you should know where that antenatal care place is. Not just gendo nyedagara, where? And sometimes if you have got the means, senior sentence into Rakunyadagara. You know, my house is over there. And this is what we should be doing. Be an advocate. You see a mother carrying a child, she's pregnant, carrying a baby here, she's pregnant, and is carrying another unknown baby. You stop that mother and say, you know, that sort of thing. Talk about it around you. Advocacy. Right. Let us make an MCR, a needs assessment in our area. Here, Wandegeya, I know you can't lie to me. You have got Katanga. You have got Katanga. Have you done a needs assessment in Katanga? An MCH needs assessment. Do we know how many women we have in Katanga who are between 15 and 49? Do we know them? In Katanga. Do we know how many children are in Katanga under 5 and their immunization status? Do we? No, we don't. Do we know the common problems women 1549 face in Katanga? Have you told them the nearest family planning clinic, marriage office is here? Have you informed everybody? These women, have you told them that marriage office there? And they tell you when we go to marriage office, we get this challenge, and then as Rotary Club, you face it. Have you talked to the women, the men in Katanga, that it is advisable when a woman is going for antenatal, you accompany her? When she's going to deliver, you accompany her? Have you tried to assess the cultural barriers within Katanga which prevent women to use family planning or to go for antenatal? Are there any cultural barriers? Are they cultural? Are they economic? And then you can write a proposal to address those challenges. Because donors who want to address MCA challenges, they are very, very, very many. Now, assess if there is a clinic around, say, Maristop is here. Can you assess, do they have any problems in delivering their services? And I'm sure if you went there, they will tell you. And one of the problems they will tell you is that their clientele turn up is very low. I had a daughter, a girl who is my sister's daughter. I talked to her, but I thought she needed somebody out. So I brought her here, and I found they were semi-idle. When I talked to the doctor, I said, well, we think there is a problem around, but we don't get clients. They don't get the clients. So you can go and assess if you have got other clinics, areas where you work. Which other area are you working in? Kamuli. Was it Kamuli? Kaliro. Kaliro. You go to the health centers, ask them, what challenges do you have? President, I will tell you, it is very shocking that some clinics don't have even what this hytometer. Huh? A tape measure or a piece of wood which they put on, he can design it for you, which you calibrate and you put it on a wall so that every pregnant mother goes there and they take the. Many of them, when you go to a card, an antenatal card, they will ask the urine. The urine strips, they cost very little money, but they don't test the urine. And eventually, when the lady is about full term, you find the legs are swelling. The legs are swelling, she's gasping, the pressure is up. But because those rural units, they don't have the gadgets. A simple thing like a blood pressure machine, very simple. They said it broke down. And as Rotarians, surely, I want to come to you, surely, you reduce for 1 or 2 days on your usual evening practices. And you have bought a BP machine and you say, President, in the same BP machine at a clinic we went to. You know, these strips for testing people's urine, you may find that even some of the government peri-urban clinics don't have them on a regular basis. And the lady goes there, the urine is not tested, the pressure is not taken, and she goes home. So dear Rotarians, these things are very simple sometimes. Now, include support to MCH in your budget. In your budget, as you contribute for polio. If you say every year, every Rotarian will contribute 20,000 towards, or every fellowship, we shall contribute so much towards MCH. So that at the end of every year, you do something in MCH which is visible, tangible. President, when you go and you move with those BP machines, you find a clinic, when you have gone to Bamanika, you find a clinic, the BP machine, give them and ask them to sign acknowledging that they have received it. And you are working. These strips. And that budget item, it is very important, Madam President. And the earlier we start, the better. MCH is not building the big things. You are building a maternity, you are building a what? No, MCH is doing the simple things which make a big difference. Now, encourage Rotary leadership to develop a standard MCH kit. A standard MCH kit. What do we as a club, what are we going to have as a standard MCH kit? We shall have a weighing scale, we shall have a tape measure, we shall have a glucometer, we shall have HB strips, we shall have urine test strips. And you know, you arrange it, and so that if you find you're going to intervene at a maternity center, you just take that kit, and within 250, you'll have a kit, and you can name it Wandegeya MCH kit. So that other clubs can copy from you. Yeah. You get it and you get a canvas, this the big tarpaulin, you put a zip and you put those things in there. headed by RS Wandegeya. And Madam Chair, Madam President, I started yesterday, and Mengo did it very well. As a club, appoint an MCH officer. And I hope by the time I leave here, I will have heard that you have appointed so and so to be an MCH officer. Mengo, they appointed Helen Belinda, and by the way, we are going to form a group so that we advance the cause for maternal and child health among the Rotary fraternity. Thank you very much.
Thank you very much, Madam Sisters. I'm sure we have learned a lot from the presentation, and our role as materials has been highlighted. And I think, as the doctor suggested, we have to appoint an MCH officer for RSC Kampala Wandegeya. And at this juncture, I'm calling upon President Robert to take us through the Q&A session. So if you have any question, please put up your hand for those of you who are physically here and online, or you can write the question in the chat room. We already have a hand up. Engineer Tebiasa, you can ask your question.
Your Excellency. Thank you, Doctor, for the wonderful speech you have given us, or training for that matter. I've got two issues. One, how can I control my height? Second, how can I control my height? Second,